Victorians are being warned to brace for a surge in COVID hospitalisations and deaths, even though the number of new cases each day is starting to stabilise as vaccination rates improve. There are now close to 20,000 active cases in the state. There were 1,500 new locally acquired infections today, a little higher than yesterday, but still lower than the state's 7-day average. And very sadly, it's been the single deadliest day in this current outbreak. The virus has taken another 13 Victorians. In total, 114 people have died in this third wave. And some patients who've been critically ill with COVID have come forward to urge Victorians to get vaccinated. Leanne Wong reports.
It was just last month when 17-year-old Sailor was gasping for air in hospital.
I was so scared, I was screaming and I thought I was going to die. And then I felt nothing.
The Year 11 student spent 15 days in intensive care, 9 in an induced coma after she caught COVID-19 at her sister's daycare. Her family of 8, including her mother Michelle, were all also infected.
I was watching COVID rip through every member of my family and hurt them, and it was so painful and I couldn't do anything. I was alone. I was helpless.
At the time, Sailor wasn't eligible for the vaccine. Now her message is simple.
Get vaccinated. That's all.
She's one of hundreds to end up hospitalised with COVID-19 in Victoria. In the last month, the number of people filling the state's COVID hospital wards has jumped from 158 to 705. ICU admissions have also tripled and now sit at 146.
Of cases in hospital yesterday, 91% not fully vaccinated.
Victoria recorded 13 deaths today, the most since September last year.
I think we all have to brace ourselves for the sadly inevitable fact that there will be more fatalities from COVID.
At the Royal Children's Hospital, there's been a second COVID scare in less than a week after a COVID-positive patient visited the neonatal ward. 29 babies were in the intensive care unit at the time. None have tested positive, but it's prompted changes. This week, rapid testing will become mandatory for all parents and carers visiting their child here at the Royal Children's Hospital. Test results will be returned within 20 minutes and anyone who tests positive will then undergo a standard PCR test.
This is not foolproof. It won't guarantee that we won't have another exposure, but it helps us minimise the risk of that happening.
It comes as the government rolls out vaccination pop-ups to neighbourhood cafes, gyms and clubs across Melbourne.
You'll see your familiar barista making your coffee behind the counter. There's no line, you can just walk up and get your jab.
The state's tracking to hit its vaccination targets earlier than expected, with Mitchell Shire coming out of lockdown tonight. But for now, Melbourne's roadmap remains unchanged.
And we'll have clarity for everybody as soon as we can. Today's just a little bit early for us to do that.
It's time to get Victoria back to work. It's time to get our kids back to school.
More Melbourne children return to face-to-face learning next week. And it's clear even our youngest are watching the numbers. Leanne Wong, ABC News, Melbourne.
So here's how we're tracking in the vaccination stakes. 86% of eligible Victorians have had their first dose. 61% have had 2. The government had predicted the state would hit 70% on the 26th of October and 80% on the 5th of November. But as we've been reporting, recent independent modelling suggests both of those targets could be hit 3 or 4 days earlier.